Well, the University of Maryland Shock Trauma Center is a worldwide leader in trauma care. It's the first coordinated system in the country and the heart of Maryland's emergency medical system. More than 150,000 people in the state have been served at shock trauma, and there's an immediate need to add a new critical care tower for shock trauma to save more lives. And this morning, Karen Doyle, Vice President of Operations and Nursing, and Marianne Rowan-Braun overseeing the campaign for the new care tower. They're both here joining us. Good morning.
Good morning.
So nice to have you both.
It's great to be here.
And Karen, let's first talk a little bit about an overview of shock trauma.
So shock trauma, we've been in existence for a little over 40 years with the vision of Dr. R. Adams Cali. He is a Korean war vet and studied shock and trauma in the war, brought that back to the United States, and he became an expert in defining the golden hour for delivering trauma care to patients in need.
Wow. And Marianne, let's talk a little bit about this campaign. What's going on here?
Well, my role as advocate for this Shock Trauma Center team of more than 500 is quite a privilege, because every single day all this team does is trauma care, trauma research, and trauma teaching. Every single day they literally hold the hearts of our friends and neighbors in their hands, and no one is watching. It's stunning to see them perform these miracles every single day. Last year, 8,378 people from the state of Maryland arrived at the doors of shock trauma in need of that time-sensitive care. We are literally bursting at the seams because, as Karen noted, our hospital was built many years ago with the capacity to serve 3,500 people each year, and we are now doing almost 3 times that number. We are in the midst of a huge expansion and enhancement for the Shock Trauma Center. And as part of the University of Maryland Medical Center over there in West Baltimore, the Shock Trauma Center is a freestanding trauma hospital. And the need for expansion comes from the need for response to critical care. More than 8,000 Marylanders arrive at the door, 60% due to motor vehicle crashes, and 97% are saved. What we want to do collectively is make sure that the community has a role in helping to secure that safety net for every person in the state of Maryland. We never want anyone to have a direct experience with Karen and Dr. Tom Scalea's phenomenal team. But if each of us could take a small role in ensuring that the safety net gets expanded, we can make sure that those in need have the care that they need. Anyone can help. At shocktrauma.org, there are multiple ways that this campaign can be addressed. A small donation is vital and valuable.
And real quickly, let me ask you, this new critical care tower, okay, what exactly is this? Explain a little bit quickly.
And I think, Karen, that's your...
So the new tower, we are expanding our critical care beds. So we will have an additional 60 ICU beds to serve the citizens of the state of Maryland, which is our mission every day, to make sure that we are open and available to every citizen in the state of Maryland. Today, our capacity is maxed out, as Marianne had said. Our current building was built for 3,500 patients. We are seeing greater than 8,300 patients per year. So we are severely limited in our capacity. So by expanding our capacity, increasing our ICU beds, we will be able to deliver care to the citizens of Maryland whenever they need us.
Okay, well, ladies, thank you so much for joining us. We really appreciate it. And of course, we're going to have more of this information on our website at abc2news.com.